Other committee commitments we have to be in. We have 3 items on the agenda today. Item number 4, AB 21 Bonta will not be heard. We're going to hold that over till next week. Senator Pan will not be here today. We will start as a subcommittee. As soon as we establish a quorum, we will interrupt and establish that. We'll get started with, looks like we have 1 member here first. Item number 2, SB 547, Lou. And if you can please proceed and please present, and thank you for being here. Good afternoon.
Thank you, Mr. Chair, members. SB 547 implements a recommendation from the Senate Select Committee on Aging and Long-Term Care's final report last year titled A Shattered System, Reforming Long-Term Care in California. This bill's purpose is to better organize and coordinate administration and delivery of aging and long-term care services and supports statewide. Last year, I agreed to put the bill over to address the committee's concerns that the bill was too far-reaching. SB 547 is still not a simple bill, but it has been substantially amended and reduced in scope. SB 547 now charges the Secretary of Health and Human Services Agency with responsibility for coordinating aging and long-term care policies and programs within the agency and across all state agency and departments. It creates an Aging and Long-Term Care Services Coordinating Council chaired by the Secretary with memberships from the other agencies and departments with relevant programs. The council is required to develop a statewide long-term care plan to operate as a blueprint for meeting the needs of the aging population while maximizing the use of limited resources. The plan would have clear benchmarks and timelines for implementation. It would be updated every 5 years, and the Secretary would report annually to the legislature on the progress being made. SB 547 also provides for the state to assume support for the ultimately expand the consumer information portal, calqualitycare.org, now operated by UC San Francisco. Currently, the array, complexity, and fragmentation of information and services and programs defy consumer and caregiver access. Providing better information is now more important than ever. The End-of-Life Option Act of 2015 provides that people choosing to end their lives must have access to and the opportunity to consider information about other end-of-life options available to them. Given our current fragmented system, they do not. The charts I provided you demonstrate my point. You've all seen them. We have 112 programs administered by 20 different agencies, offices, and departments. The system is really unnavigable. Your committee analysis points to the number of aging and long-term care related advisory committees that exist, bills that have passed, and reports that have been issued over the decades. And yet, seemingly, nothing has happened. If anything, the landscape of policies and programs has become even more complex. Clearly, aging and long-term care is not a state priority. The Select Committee's 2015 reports identify 2 things that have left the aging and long-term care system disheveled: no leadership and no accountability. So SB 547 addresses these deficiencies by making the Secretary of Health and Human Services responsible and accountable for coordinating aging and long-term care within the agency and across all state agencies. It also capitalizes on the legislature's renewed interest and activity in overseeing the implementation and effectiveness of programs. Our role is critical. What is proposed here is a mechanism that we can use to address many challenges facing California. We can't reorganize around every crisis, but what we can do is mobilize the expertise and resources we have to problem solve these challenges through better intra and interagency communication and coordination. We'd like to think this level of interaction occurs on the natural, but we know it doesn't. I've patterned SB 547 after the Climate Action Team created by the Governor's executive order in 2006. The combined actions of the CAT as it is known, and subsequent legislation have made California an international leader in combating climate change. We can be the leader in aging and long-term care. Members, almost 20% of our population will be 65 years or older by 2030. If we start doing the work now, we can avert the crisis of overwhelming our social service resources while promoting healthy aging and aging in place. This approach will benefit all of us, and I respectfully ask for your aye vote.
Before we ask for any testimony, I'd like to establish a quorum. Would you call the members, please?
Hernandez?
Here.
Hernandez here. Wynn? Here. Wynn here. Hall?
Here.
Hall here. Mitchell? Monning?
Here.
Monning here. Nielsen? Here. Nielsen here. Pan? Roth? Here. Roth here. Wolk? Here. Wolk here.
Thank you. We have quorum has been established. We're going to go ahead and ask the individuals who are going to present, state your name, and please proceed.
Yes, Mr. Chair. Mr. Chair, members, Darrell Kelch with the California Association of Area Agencies on Aging. Area agencies have long tried to bring attention to the fact that the system is broken and that this fragmentation that seniors out there have to work through in order to get services. We applaud the senator for introducing this bill. I'll be quite honest, it doesn't go as far as we want. You know, we'd like to create just off the chute, you know, a new Department of Aging and Adult Services, but this is a significant step towards bringing attention to the issue and setting up a process whereby we can look for answers. So we definitely support the bill and ask for your aye vote.
Thank you. Anyone else in support?
Carol Sewell, California Commission on Aging. We are continually grateful for Senator Liu's efforts to address the problems in our aging and long-term care system, and we strongly support this bill.
Thank you. Is there any opposition? Any questions from any of the members? We have a motion. Is there any, seeing no questions from the members, would you like to close?
I simply ask, we'll keep this short, I simply ask for your support of the bill. Thank you.
Thank you. The chair is recommending the support. Item number 2, SB 547, moved by Senator Roth. Would you call the members, please?
The motion is due pass. Due pass.
Just leave it. There you go.
Due pass as amended. Due pass to appropriations. Hernandez?
Aye.
Hernandez, aye. Wynn? Aye. Wynn, aye. Hall? Mitchell? Monning? Aye. Monning, aye. Nielsen? Aye. Nielsen, aye. Pan? Roth? Aye. Roth, aye. Wolk? Aye. Wolk, aye.
That has 6. We have some members that are absent. That's enough to get out. We're going to place that bill on call. And
Thank you very much, members.
Senator Anderson is not here. I believe I see Senator Bates. We're in item number 3, SB 787, hospital closures. Senator Bates, good afternoon and welcome.
Get my witnesses up here. Well, good afternoon, Chairman Hernandez and members. I'm pleased to be back with you to present Senate Bill 787. The bill will allow the Department of Public Health to authorize Saddleback Memorial Medical Center in San Clemente, which we know as San Clemente Hospital, to continue operating the only emergency department that's located between Mission Viejo in Orange County and Oceanside in San Diego County. By the way, both those cities are comprised of 36th Senate District. This bill is for the local communities around the hospital. Without the bill, the emergency department that is critical to at least 3 cities in South Orange County, and that has been there for more than 40 years, will likely to be forced to close. And I want to thank Chairman Hernandez and the committee staff for coming down to San Clemente during the interim to see the unique challenges our community faces with respect to the geography and traffic in that region. I also appreciate that Chairman Bonta and Assemblymember Ridley Thomas were able to join us for that interim study tour and the discussion. Both Assemblymember Bill Breaux and I have been working for a year with the stakeholders in order to help find a solution that will allow the San Clemente Hospital Emergency Department to stay open as Memorial Care Hospital System, health system continues to explore a conversion of the facility. For those who may not be entirely familiar with Southern Orange County, San Clemente is roughly 15 miles south of the city of Mission Viejo, and it is over 20 miles north of Oceanside, separated by Camp Pendleton. Mission Hospital Regional Medical Center in Mission Viejo has the next closest emergency department to San Clemente, and the problem is that the average transport time to that hospital from San Clemente is already 17 minutes, and there's a widening project underway on I-5. Transport times can double and be over 30 minutes, and that project just began, so we're looking out over 3 years that will probably have that impact. The bill is narrowly crafted to only apply to San Clemente Hospital. We believe that the medical professionals have addressed the patient safety issues raised in stakeholder meetings. What I cannot fix is the complaints from opponents about hospital financing and profits, and I might make a little footnote to that. I think we all know that in the universe that we are now faced in healthcare, the financial issues probably take second place in terms of whether they remain as they appear today. And I think there's a number of situations throughout the state of California that validate that. This bill is fundamentally about access to emergency care. Members, I think we can agree that more access to emergency care is better than less. If this bill passes, there will be more access to emergency care. If it fails, there will be less. There is strong support in the cities of San Clemente, Dana Point, and San Juan Capistrano for keeping this emergency department open. The bill is supported by the emergency room doctors at San Clemente Hospital and by the Orange County Fire Authority, which transports the 911 patients. The bill allows, upon approval by the Department of Public Health, the owner of San Clemente Hospital to convert the facility based on an updated model of care while continuing to operate the emergency department that the community needs and wants. The witnesses today in support to provide additional testimony: Tony Struthers, he's administrator for San Clemente Memorial Center, San Clemente, and Chris Ham, who's the council member in the city of San Clemente, and also a firefighter with the Orange County Fire Authority.
Thank you, Senator. Let me just remind everybody that this bill was heard last year. We did do a tour. It was originally supposed to be a vote only. I allowed the author to bring some witnesses. If there's anything you need to share that's different from the original testimony, by all means. If not, if we can just keep it brief. Whatever time allotted to the support, will allot the same amount of time to the opposition. Anyway, thank you, and please proceed. State your name.
Members, Chairman, members of the committee, good afternoon. I'm Tony Struthers, administrator for the San Clemente campus of Saddleback Memorial. The shape of healthcare services is changing in California and around the country. Patients are moving from inpatient services to outpatient, from hospital-based to community-based care. And as a result, small medical facilities are struggling and in many instances shuttering entirely. Yet in California, inpatient facilities are required if you want to offer emergency services. Saddleback San Clemente's campus has been facing precisely these industry-wide difficulties with extreme results. Since Saddleback acquired this facility in 2005, both our inpatient census and inpatient surgical volume have fallen dramatically. Our daily inpatient census currently hovers in the low teens and many days drops below 10. On Monday, the day I come up here, we had 6 inpatients and no inpatient surgeries. These declining trends are consistent locally, regionally, and nationally, placing an already small campus like San Clemente at particular risk. We have incurred significant financial losses on the campus, and has become economically unviable to operate the San Clemente facility with so few patients. In the face of this reality, Saddleback must act to transform the aging acute care campus into one that aligns with the community's needs and is responsive to the rapid evolutionary changes occurring in healthcare. After significant dialogue with hundreds of residents, civic, and community leaders, we determined that one avenue to meeting the community needs would be to operate an emergency department under Saddleback Laguna Hills hospital license. In other words, a satellite emergency room on the San Clemente campus, and replace the acute care facility with a number of outpatient medical and healthcare services. However, current law does not allow for a satellite emergency department. We support Senate Bill 787, which would allow Saddleback to convert the existing acute care campus into this satellite emergency department. We are committed to meeting all of the patient safety criteria that is already included in Senate Bill 787, and our commitment to quality and safety of emergency services would not be compromised just because it's a satellite emergency department. And we are committed to work with the California Department of Public Health, should this bill pass, the Orange County Emergency Medical Services, and other health agencies to ensure that this satellite emergency department will continue to uphold the highest standards of emergency care and meet all regulatory requirements. This bill would allow us to collaborate with CDPH and to ensure the level of service in the satellite ER is equal to what is provided today in our emergency department. Again, we would provide the same level of service that we currently provide today should this bill pass. I would like to personally thank Senator Bates for her leadership on this issue, and Chairman Hernandez, thank you for coming down to our community and listening to our concerns. Thank you.
Good afternoon, Senators. My name is Chris Ham. I'm a city council member for the city of San Clemente. I started down this road a year ago as the mayor of the city of San Clemente, and this has been a very important issue for our community. This afternoon, I'd like to share with you a couple of things that Senator Bates said and a few personal experiences I've had as a firefighter in the city of San Clemente. The first thing I'd like to reiterate is the fact that our community is a cul-de-sac, for lack of better terms. We have the Pacific Ocean to the west, Camp Pendleton to the south, and Cleveland National Forest to the east. We have, if San Clemente Hospital closes, we have a 40-mile gap between the two nearest hospitals, 15 miles being the closest at Mission Hospital. That stretch of freeway between our city and Mission Hospital by the state has been represented as one of the top 10 worst sections of freeway in the state. So I believe, and the community believes, that that is just too far of a distance to travel in an emergency situation. The other thing I'd like to share with you, as a firefighter in the city of San Clemente, I have the misfortune of transporting few of the 5 pediatric respiratory arrests that we have in our community every year. Fortunately for us, we have Saddleback Hospital in our backyard, and we are able to save 4 out of 5 of those pediatric respiratory arrests currently. And it would be a huge disservice to our community members, to our visitors, to the 200,000 average daily trips driving up and down the 5 freeway to close this emergency room. So with that, I'll ask for your support on Senate Bill 787, and thank you for your time.
Thank you. Anyone else in support?
Good afternoon, members of the committee. John Moffitt on behalf of the Orange County Fire Authority. For all the reasons stated, we are in support of the bill.
Thank you. Anyone else in support? Opposition? We have approximately a minute 35 seconds for opposition. If you can please come up, state your name and your position.
Mr. Chair, members, Tim Madden, representing the American College of Emergency Physicians, and I have kind of a tweener position, so hopefully I won't get into the opposition's straight testimony. We have an oppose unless amended position, and our membership has struggled on this issue for years in terms of a freestanding emergency department and what type of an impact it might have. But given how things have been changing in the healthcare delivery system, we thought now was a good time to engage in this conversation in a more meaningful way. We've developed a set of 7 principles which we think need to be in place if a freestanding emergency department is to move forward, a number of which are included in SB 787 as a direct result of conversations we've had with the senator and with Saddleback. So we want to thank them for their time and their openness to our concerns. With that being said, we still have a few things outstanding, which still keeps us in an oppose unless amended position. But at a minimum, I just wanted to share our productive conversations with the proponents of the bill. Thank you.
Opposition, please state your name and position.
Working. Oh, good afternoon.
The speakers haven't, the intercom system hasn't been working. It was my mistake. It wasn't a minute 30. It was, how much time? About 6 minutes, so
Okay.
my apologies. Anyway,
Thank
please
you.
proceed.
Mr. Chair and members, good afternoon. Michelle Cabrera with SEIU California, we also looked more deeply into these matters during interim study, and thank the author and the committee for bringing folks together and allowing us to look more thoroughly into this matter. One of our findings as we were looking through the data related to Saddleback is that this is a hospital which operates with a 9% profit margin and currently serves about 2% Medi-Cal. With very, very minimal uninsured. And so from the perspective of margins, just to put it in perspective, the statewide average is about 2.6%. So one of the things that we've struggled with or found troubling is that the proposal before us today is sort of presented as an either or. The only option is to convert to a freestanding emergency department, which in our view would be misleading to the public who doesn't understand what is available and what's not. They have a fair expectation that if they are in an emergency and they go to a place that is called an emergency room, and that person needs an emergency surgery, for example, or they have a blood loss for which they need a blood bank, that those services will be there to care for them. So we struggle to understand why this is the only option. The hospital seems to be operating at a very healthy profit margin. They are a nonprofit corporation with a charitable obligation to the community that's being served. So those were some of the challenges that we faced in looking at this. We think that from a consumer protection standpoint and also from a health and safety standpoint, this was challenging. The nearest hospital, in fact, is about 7 miles. It is operated by Mission, and not 14 miles away. 14 miles is the other hospital operated by Memorial Care to its north. And so we just think that there were some dynamics that were off the proposed amendments. Unfortunately, were not brought up in our conversations with the author and other stakeholder conversations that we were a part of, at least. And we think that the regulator in this case would not have any real guidance or latitude from the legislature from which to modify anything about this proposal. And for all those reasons, we remain opposed.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association. We also appreciate you all and the Assembly side extending the invitation to all the stakeholders to be a part of this discussion, so we appreciate that. But in that discussion, CNA was kind of further entrenched in their view that the standalone ER proposal was in jeopardy. With respect to their model, there were insufficient answers to our questions as to how the blood bank was set up. There were issues on delivery and transport. So as you all know, there are 6 essential services that need to be included to have a full functioning ER. Blood bank is one of them, and it's a very efficient and necessary service, and that question was not answered to our satisfaction. In addition, this particular area of Orange County has many thriving hospitals located in close proximity. Laguna Hills is better equipped to handle the more sickest patients, and in their own words, they have said that Saddleback is bypassed and they send their sickest patients to Laguna Hills campus. So to us, their model seems more appropriate for an urgent care center. That way, there won't be any confusion by the constituents that go to their community hospital, and it'll be safer for patients. So with that, and with all of the hospital closures and all the medical redlining that has happened throughout the decades, we believe that that is a more serious issue that needs to be addressed, and that is also the heart of the matter. So with those and other reasons that we can talk at a later time, we oppose the bill. Thank you.
Mr. Chair, member Sarah Fox from the California Labor Federation. We'd like to associate ourselves with the comments from my colleagues. I also would add that even though this is a one-off proposal, there is grounds for a lot of confusion among consumers in this community. If you walk into something that's called an emergency department, you're expected to have the full range of services that go with that. This freestanding emergency room would not. We also are very sensitive that consumers now are facing huge costs in healthcare. And when you go to an emergency room, you're often paying a much higher copay than you would if you were going to an urgent care or other services. So we think there's some outstanding questions around consumer education, consumer understanding the services, and very importantly, billing. That is not addressed in this legislation and in a one-off proposal. So we appreciate the efforts, but we think this is a larger conversation and do oppose.
Thank you. So anyone else in opposition? Any questions or comments? I don't know who went first. We'll go with Senator Roth and then Senator Nielsen. Yes, Senator Roth.
I know, thank you, Mr. Chair. I know I mentioned this to the author. You know, I think this is a much larger issue. I mean, I sympathize with the plight down in San Clemente. It's a much larger issue in the state, having to do with small hospitals that are being forced to close, and we can't cause them and make them stay open. We have a requirement that you have to have hospital beds in order to have an emergency department. We have other emergency departments, I have been told, and certainly I have experienced, that are clogged where the waits are 6 to 8 hours. And so I would have preferred to have this bill take the form of a pilot program and a study where we could expect reports back to this committee and perhaps the legislature as a whole on the effectiveness and efficiency of this model, the deficiencies of this particular pilot, for example, because we also need to take a look at scope of practice for the paramedic force, triaging patients, the ability to take patients to urgent care facilities, which is my understanding they cannot do. So we not only have the availability or a lack thereof of medical services in some parts of the state, but we have problems with respect to our regulatory scheme, it seems to me, in dealing with congestion in emergency departments today and the changing face of the healthcare delivery system, where it's not patients in beds, it's patients in ambulatory centers, whether it's surgery or otherwise. So I have some concerns. I think we can probably make some adjustments in this. I do think we need to have a larger discussion in this committee and in the legislature, and I think we need to have some pilot programs set up in these various areas with metrics for evaluation, so we can determine what is the new face of the healthcare delivery system and how can we do it in the most effective and efficient way. So thank you, Mr. Chair.
Thank you. Senator Nielsen?
Yes, I'd like to sort of pick up on that theme of a pilot. I'm not convinced that we ought to just summarily dismiss this bill, that the arguments against it are not compelling to me or sufficiently compelling to accept that we should just say, well, okay, dismiss this, let it go. San Clemente, forget about it. You take them 14 miles down the street. I think that's kind of a callous disregard for people, and I speak on behalf of someone who's represented 19 different California counties over the years and have dealt with many, many situations with hospitals and ERs. And our ERs are now particularly impacted by thousands, tens of thousands of individuals that are put out on the streets now that are showing up in the ERs, put out on the streets by actions of this legislature, as a matter of fact. And they are really impacting our ERs. But I feel if we just say, well, okay, we don't like this bill and let it die and walk away and forget San Clemente, I think that we're not just harming the people of the community of San Clemente, I think we're losing an opportunity to maybe work on a model of some way, a pathway out of some of these problems. Do we see any prospect of sitting down and resolving some of your concerns in some ways? I don't think we could resolve all of them, but couldn't we resolve some of those concerns?
Mr. Nielsen, appreciate the question, and my colleagues can weigh in if I don't capture their concerns appropriately. I think we've all said here in one voice that we were a part of the stakeholders process, and we've thanked both sides for inviting us in on that process to ask questions and try to resolve concerns. But unfortunately today, our questions haven't been answered to our satisfaction. So right here today, we reject this proposal. We're always willing to sit at the table and come to some sort of agreement or some sort of pathway to understanding the best way to approach this issue. And it's not just issues of San Clemente, and I think we'll just have to respectfully disagree that we don't believe that there's a problem that exist in your area that would warrant this bill. There are problems in LA, there are problems in Modoc County, there are problems in all areas of the state that we need to look at what's the best way to approach this systemic problem. And we believe that there are hospital closures that are happening around this state more often than not. There are urgent care centers that are shutting down. There are systemic problems that exist that are leading us to where we are today, and we're a part of a larger solution. So short answer is yes. I mean, we definitely would like to sit down to come to some mutual areas of concern, but just today we're not there yet. And we've been engaged in one conversation in the interim, and we're open to more, but we made ourselves available for the time that we were given, and we'll be happy to participate in more.
Well, don't we have some more time to work on this particular bill?
Not on this particular bill. It has to be up by this week.
If I may, I also want to propose a solution, and I think it unfortunately does not require legislation. Plan A for Saddleback Memorial was to open up a state-of-the-art urgent care center. And it, I believe, looks a lot like the proposal that's before us today, but it is not waiving any rules about the clear line that exists about what is and what is not emergency care. And so they can do all of the things that they want to do now. They just won't be able to bill Medicare, and they won't create confusion for individuals about what they're walking into, which is a state-of-the-art 24-hour, 24/7 wonderful urgent care center that more fits with what they believe the needs of their community are. The problem was the community didn't like that. The doctors who paid for seismic upgrades to this hospital did not like that. It used to be a doctor-owned facility and was sold to Memorial Care. And so there was a lot of turmoil in the community about what they had felt was the deal that they had struck with the hospital owner, which was, we're going to hand this community resource over to you to continue to operate it as a hospital. And when they'd said, we'd rather do urgent care, the community was very upset. And that's my understanding of the events from many conversations. I know a lot more about this community now than I would have ever imagined, you know, with the stakeholders. And so I think if they go back to Plan A, it doesn't require legislation, but they're left with a community that's not happy with them.